My name is Taylor Goddard, and I want to speak a little bit about the profession of a registered respiratory therapist. According to the American Association of Respiratory Care, also called the AARC, in the article titled The History of Respiratory Therapy, the respiratory therapy profession first became a concept in 1943 by the medical doctor named Edwin Irvine of a local Chicago hospital. It wasn't until 1973 when the respiratory therapist became nationally recognized with the creation of the American Association for Respiratory Therapy. Today, I want to inform you about the career of a registered respiratory therapist with a specific focus of the role of a respiratory therapist in the emergency department. In this speech, I will explain the educational requirements to become a respiratory therapist, the job duties, a typical salary for the position, along with advancements made to the field in recent years. I will also touch briefly on why this career path is meaningful to me. Respiratory therapists are defined by Cleveland Clinic as in their online article titled Respiratory Therapists published in 2023 as healthcare providers who help diagnose, treat, and manage conditions that affect your lungs. To join this profession, several educational steps must be completed. First, you must obtain a high school diploma and or a GED, followed by completion of a 2-year respiratory care program at an accredited college. Then, you must complete an approximately 1,000 hours of graded clinical experience where you are observed and critiqued by a clinical instructor. Finally, you must pass 2 board examinations administered by the National Board for Respiratory Care, the NRBC, to receive a registered respiratory therapist credential to start practicing. Once you complete all examinations and schooling required, you now gain the responsibility of caring for patients. Duties of a respiratory therapist in the emergency department once you obtain your registered respiratory therapist license and start practicing independently can be very demanding. Respiratory therapists provide life-saving treatments from managing asthma to caring for patients who require mechanical ventilation. Respiratory therapists perform both emergency and maintenance therapies, including breathing treatments, airway management, oxygen therapy, and more. Due to the importance of the registered respiratory therapist role and demanding duties required, respiratory therapists can be paid a competitive wage. The nationwide average earning of a respiratory therapist depends highly on your experience and your location within the United States. According to the U.S. Bureau of Labor and Statistics and their Occupational Outlook Handbook published in 2024, the median pay for respiratory therapists was noted at $80,450 a year. Places like Washington, D.C. and New York City are U.S. cities where the respiratory therapist median pay is higher than the nationwide average. Respiratory therapists are compensated for their roles due to the high stress and rigorousness. But is there any way to advance the way respiratory therapists treat patients that may relieve certain stresses? Recent development in respiratory care practice is providing assistance to the therapist by allowing for faster and more thorough patient turnover time. With integration of AI-assisted ventilator systems, which help respiratory therapists work ventilators with more accuracy, which allows for higher quality of care. Technology in respiratory care has rapidly advanced since the COVID-19 2020 global pandemic, which made the role of a respiratory therapist more essential in modern healthcare. In closing, my goal for today was to inform you about the rewarding and essential career of a registered respiratory therapist. We reviewed educational requirements, job duties, potential earnings, and new advancements in respiratory care. As I noted before, respiratory therapists were needed at a higher rate than ever recorded during the 2020 global pandemic caused by COVID-19. Respiratory therapists are relied on by millions nationwide to assist in diagnosing, treatment, and maintenance of their unique lung diseases. There is a huge push in the advancement of respiratory therapist field, and I'm excited to see where it takes us. Thank you for listening.